Welcome back to the Morning Blend. This is National Hand Therapy Week, and in honor of that, we brought in an expert to tell you about hand problems, how they're diagnosed and treated.
Linda Klein is a certified occupational hand therapist at Surgery Ltd. She's going to give us some tips and tricks to make sure that we don't injure ourselves this spring and summer. Good to see you.
Right. Thank you.
Thank you.
I think this is great. And you know, a lot of people, some people know, some people don't, that this is National Hand Therapy Awareness Week.
Right.
And so this is a good time to start thinking about the things that we're doing in the spring and summer that can injure us. And so what are some things this time of year that people do that maybe they start having some soreness in their hands or joints?
Well, in the spring and summer, when the weather turns nice, like it has been these last few weeks, boy, we can't wait to get outside.
Right.
I see so many people out on their bikes, bicycling, and that is just so wonderful. But you know, that puts us in a really funny posture and puts a lot of weight on our hands.
My hands were so sore after biking this last weekend.
Right.
Right here.
Right. And one of the biggest things is there's a nerve that runs right through that side of the hand, and your little finger can get tingly if you keep that pressure on the side of your hand for too long. So really wearing bicycling gloves, which has padding right there, is one really important thing to do when you get out bicycling for longer distances. And also, if you get the opportunity safely to take one hand off and just stretch it and get that weight off of it and get out of that tightly gripped posture. So those are two of the biggest things for hands and bicycling.
And gardening too, because I think there are a lot of people, you know, they call them weekend warriors. Me, for example, I did all my planting in one weekend, you know, trying to get it done.
Me too.
And you brought some good examples of things that we can be doing to kind of help prevent pain or injuries when we're doing all those kinds of things in our yard now that the weather is nicer.
Right, gardening especially. The American Society of Hand Therapists actually has on their website, available for the public and patients can click on there, and they can see a variety of safety and prevention tips, and gardening is one of them. I think one of the biggest things for gardening is to wear gloves. Thorns from rose bushes and just needles from the evergreens that are into the ground can puncture, and we can see some nasty infections.
Oh, well, people asked me if I had a cat because I took out 6 rose bushes, and they were like, so I mean, my hands were all scratched up. I had scratches on my legs, and I was wearing gloves, but they weren't the high ones like the ones that you brought today.
I just found those at a local hardware store, and I was like, I have to get those, because even pulling weeds from bushes, you're reaching into the branches area, and it can scratch up your forearms. But there's also ergonomic tools available for gardening, and the diagram on the table there shows how that will help. When we do a lot of digging or pulling weeds, oh my gosh, the dandelions, and you're using that weeding tool, and we're doing this motion with our wrists repeatedly, we can very badly aggravate the tendons on this thumb side of the wrist, and we can put pressure on the carpal tunnel, and the thumb base joint here can really become aggravated. So the tools are designed to allow you to hold your wrist straight and have a light fist on it, and use more of the upper arm to do the digging or the weeding with. So the diagram that we have there shows how that keeps the wrist in alignment with the tool and prevents that overuse of the wrist with the side-to-side motion that can lead to tendonitis.
A lot of people get out and play tennis this time of year too. I'm sure there's even tennis elbow. I don't know if it's related to tennis or not, or if that's just the term, but you know, I think all these different summer activities we want to get out, but they can be a little sore. What do you as a hand therapist do if someone comes to you and says, you know what, I've been out biking, or I've been gardening, or I've been doing whatnot this summer, and I'm starting to get some soreness?
Well, we would sit with them and devise a customized treatment plan for them. We'd want to first assess their sensation, see if they've got some nerve impingement, assess their strength, see if whatever's going on has affected their grip strength or their pinch strength, and their motion. And then talking about the history of what's caused the problem, we would come up with recommendations for stretches, for some of the things like we've talked about, padded gloves, exercises to strengthen certain things that may be weak that led to perhaps tennis elbow. So each person is dealt with an individualized treatment plan following an evaluation.
What about those stress balls that people can buy? Are those good for anyone?
They can be good for initial strengthening after, let's say you've had a broken bone and the doctor says it's time to go ahead and do strengthening. Those stress balls can be a good initial grip strengthening device, but if you have a nerve compression or you have a tendonitis and you go ahead and you start squeezing, that can make the condition worse. So it is good to see a specialist, like a hand surgeon or a hand therapist, to find out if you're doing the right thing for what you think you have.
And speaking of calling on a specialist or someone who's an expert in hand surgery in particular, if you have a traumatic injury, like people are out using lawnmowers and other, you know, powerful pieces of equipment, because you were talking about more like chronic problems or some repetitive motion kinds of issues. But if you have a traumatic injury, I think it's more important than ever to call a specialist like a hand surgeon.
Absolutely. We have seen so many fractures this year with the icy winter that we had, the slippery winter, many wrist fractures, finger fractures. And we also see a lot of people who've had sprains and just think, you know, they'll heal and they don't really see someone. And then they see us months later with a finger that just doesn't work right. It's just stuck in a bent position, or it won't bend. And even in that situation, there's things that can be done with certain positioning devices and braces and injections. Not everybody needs to have surgery, but occasionally it's necessary. But lots of sprains and broken bones and tendon injuries with cuts. We've seen a lot of those lately as well. So trauma is something that you definitely want to see a specialist for, you know, trauma to the hand.
All those kids too out there with the jammed fingers playing ball. Oh my gosh, see a hand surgery specialist. Here's how you can contact Linda or any of the great doctors at 414-453-7418 or handsurgeryltd.com for more information. Thanks, Linda.
Thank you.
Thank you so much.